Hi, my name is Ariel Sanchez, and I will be talking about victims of suicide as my special population. Here are some facts about suicide. It is the fourth leading cause of death in 22 to 44-year-olds. 2016, about 44,965 Americans committed suicide, and men die almost four times as much as women do. In particular, this group is middle-aged white men who represent the highest percentage of suicide victims. Some myths about suicide. People who are suicidal want to die. That is not true. There is a lot of people who have survived suicide that tell stories of how they immediately regretted it. Most people who say they're suicidal are just bluffing. That is not true. It is common for somebody to try to reach out and talk to somebody that they're suicidal before they actually attempt a suicide. There is no way to help. That's not true either. There are plenty of ways to help. Suicide is totally preventable. You can talk to people and give them the right resources. And only the mentally ill commit suicide. That is not at all true. There are a lot of demographics that commit suicide, and we are going to talk about certain populations that are more prone to suicide than others. Some populations that are more prone to suicide than others include American Indians or Native Americans, individuals with medical conditions like chronic illness and terminal illnesses, people with mental disability or substance abuse problems, the LGBTQ populations, the members of the armed forces or veterans, and men in midlife and older men as well. Native American teens have a suicide rate that is twice the amount that you would find in the general population within the same age group. Some of their risk factors include alcoholism, a lack of connectedness to their traditions, culture, and spirituality, a lack of mental health care facilities available. There's also a contagion effect. Living within a small space like a reservation, when one person commits suicide, there's a high chance that somebody else will also commit suicide. There is also trauma that they might experience, not being able to speak their language, being forced to speak English. Relocation is a problem. And there's an LGBTQ community within the American Indian community as well. And that's one thing that we will see throughout is this sort of intersectionalism and how it relates to suicide. The LGBTQ community is also very prone to suicide and suicide attempts. About 30% have admitted to at least attempting to commit suicide once in their life. Um, it is also important to note that transgenders, over half, have attempted suicide in their life. Over half of all transgenders have attempted suicide in their life. That is a real problem. Some of these are due to being rejected by their families, feeling bullied, harassed, feeling unsafe within their community as well. Another group I would like to talk about is our military, our armed forces, those who are fighting overseas for our country. There are estimates that are as high as 14 to 20% of all suicides in the US are done by military veterans. Um, their suicides have actually, the suicide rate has actually jumped 10% in 1 year. Here are the predisposing factors to suicide. A couple I've already gone over, and some more I would like to highlight. Having a family history of suicide. That is a big one because there is a good chance that when you know somebody who committed suicide close to you, there's a higher chance that you would commit suicide as well. Um, Local epidemics of suicide, cluster effects. These happen, just like I said in the American Indian Reservation, there's a sort of contagion effect. When you know somebody, again, when they commit suicide, it's easier for you to commit suicide. Physical illness, chronic conditions, people, even with migraines, when they just can't take it anymore, it's a higher chance of suicide. This one right here is something we need to really be concerned with: unwillingness to seek help because of the stigma attached to suicide. Now, I feel as a nation who is concerned with preventative medicine, this is something that we should be spearheading from a social stance to get rid of the stigma to better help people. And I will be talking about this a little bit in the next slide as far as what healthcare is doing to prevent suicide. So, what can healthcare do to prevent suicide? Well, the majority of people who attempt suicide, about 64%, visit some sort of a doctor in the month before their attempt. So there has been some recommendations like screening patients to identify who is at risk, assessing the patient's level of suicide risk, working with patients to create safety plans that include how they will reduce their access to lethal means such as firearms or poisons, and completing caring contacts, following up with patients by phone, email, or text within 48 hours of their healthcare visits. So my questions to you are, how effective do you think it'll be to implement these new healthcare practices? And suicide is still stigmatized. How do you think that affects us as a nation?